Excuse me, Cole, you're muted. Could you please unmute?
Yes, I was just informed that I was muted for the past couple of minutes. Again, shows how we are at the mercy of technology. My apologies. So I was saying good morning and good afternoon, everyone. I am Brahima Koulibaly, Vice President of the Global Economy and Development Program at Brookings. It's great to be with you. Thank you for joining us for this important conversation with Dr. John Nkengasong, Director of the Africa Center for Disease Control. As the COVID virus began to spread, many experts had predicted devastating outcomes for the region, with some predicting up to 40 million cases by last summer. Some of these dire predictions were understandable. The healthcare system and infrastructure are largely fragile in many countries, and access to quality healthcare is limited, despite some countries' recent progress. The most popular prescriptions to contain the spread of the virus, such as social distancing, are challenging to implement in Africa, where a large share of the population lived in crowded slums. With the confinement measures, many millions of workers' livelihood were in jeopardy because they had limited access to broadband connectivity, telework, or other opportunities to maintain basic incomes. Even the most basic recommendation to wash hands regularly assume that everybody had access to clean water, which is not the case for a large share of the African population. Thankfully, these dire predictions have not materialized, at least not yet. And as of yesterday, the continent has recorded 3.5 million cases of COVID-19 and almost 90,000 deaths, with the cases largely concentrated in a few countries. So while immensely tragic, these numbers are lower compared to other regions. But even so, I think one death from COVID is one too many. And looking ahead, there remain significant challenges, especially as new and more infectious variants spread around the world. And the region continues to lag on access to the COVID vaccines. In this regard, the need for global solidarity to ensure universal access to the vaccine cannot be overemphasized. Given the global nature of the pandemic, I think until and unless everyone is safe, no one will be safe. Key to Africa's response has been the efforts of national governments and regional institutions, notably the African Union's Center for Disease Control, first established in 2017 in the aftermath of the 2014-16 Ebola outbreak. And despite its relatively young age, the African CDC has worked tirelessly to improve testing, implement best practices across Africa, among other actions. The success of the CDC owes largely to the leadership of its director, Dr. John Nkengasong, whom we have the pleasure to host today to discuss those successes, but also the challenges that lie ahead. Africa could not have hoped for a better person than John to lead the region CDC at this critical moment. John is an accomplished health professional and a scholar. In addition to numerous awards and degrees, most recently, he has served as one of the HWO's Director General Special Envoys on COVID-19 preparedness and response. He is an adjunct professor at Emory University, the School of Public Health in Atlanta. He serves on several international advisory boards, including the Coalition for Epidemic Preparedness Initiative and the International AIDS Vaccine Initiative, among others. John has authored an excellent essay in this year's Foresight Africa, that is the Africa Growth Initiative's annual publication on the top priorities for the continent in 2021, laying out his vision for the CDC and describing how African governments can prepare better for the next epidemic. I will encourage you to read it if you have not already. along with supplemental contributions from global experts on vaccine rollouts and the role of national public health institutes. John, thank you for your leadership, and it's my distinct pleasure to welcome you. I now turn it over to our AGI director, Dr. Aloysius Ordu. So over to you, Ordu.
Thank you for your kind words.
Okay, thank you very much, Ko, for those warm remarks. Greatly appreciated indeed. Good morning, everyone, and good afternoon to our audience here in the United States, in Africa, and around the world. Welcome to Conversations with Brookings Africa Growth Initiative. This is part of a series of conversations we intend to have going forward on the key issues of tremendous consequence for Africa. As our VP Cole just mentioned, on the 27th of January, we launched the AGI's flagship report, Foresight Africa 2021. You can download that report if you haven't already done so on our website at Brookings Global. The report presents the top priorities for Africa, at least the way we see them, in the year ahead. You'll find a brilliant piece that was just referred to in the report authored by my good friend John Nkengasong, our guest today. Now, here are some housekeeping matters. Viewers can submit questions throughout this session via email to events@brookings.edu or via Twitter @Brookings Global, or by using #pandemicprep. From wherever you are right now, please join me by clapping to welcome our special guest, John Nkengasong, Dr. John Nkengasong. So John, I'm particularly delighted to kick off this series with you, one of Africa's favorite sons. You obviously bring a wealth of experience and impressive qualifications, as Cole just mentioned. I bid you welcome to Brookings AGI.
Thank you, Aloysius, for your kind invitations and for your very warm words. I look forward to having a very good conversation with you this afternoon or this morning, your time.
Great, thank you very much, and welcome. Let's begin, John, with Africa's response to the pandemic. You recently published your annual report, which I have here, the 2020. For our listeners, this impressive report can be found in the Africa CDC's website. John, I commend you and your team indeed for the hard work and the achievements. Could you share with us today two of the key achievements that you are most proud of?
Thank you again, Aloysius. I think let me first of all start by making two. First is that in 2 days, that is the 14th of February, it will be exactly 1 year when the continent of Africa reported the first cases of COVID-19. That was in Egypt. And that is important because 7 days later, the leadership of the African Union, headed by Chairperson Moussa Faki, convened an extraordinary emergency meeting of all ministers of health in Addis Ababa to endorse a strategy, what we call it the joint continental strategy for COVID response. Mm-hmm. I start with that to segue into one of the answers to your two main achievements is that I've been impressed by the extraordinary leadership of our continental, the political leadership that has rallied around the African Union and also the African Union Commission. The African Union led by His Excellency Cyril Ramaphosa, who had led the whole COVID response on the continent to now, and of course the Commission led by Chairperson Moussa Faki. It is important as one of our key achievements to see leadership in play to address the challenges of our time. And I started with February 14 because people always say, well, a continent, maybe what is happening on the continent is by chance. No, it's because of anticipated leadership. where the leaders took this seriously. They saw the threat and took it seriously. And when the ministers of health left Addis Ababa on the 22nd, there was clarity of action and clarity of the danger that it poses. Mark your illusions that ministers who were traveling outside of continent rerouted their stay and cut it short to come to Addis Ababa for that meeting. For example, the Minister of Health of Nigeria was in Europe and how to reroute to Addis Ababa for that meeting. So those early measures were very important in blunting the spread of the pandemic. So when in early March, countries started having many cases started spreading, and this time around coming in from Europe, countries had understood what to do exactly. I think that is important. The second thing that you asked for, which I'll tell you, is that beyond leadership is the cooperation and coordination across the continent. I've never seen in any efforts in this manner, or the African countries coordinating their efforts through the Africa CDC in the manner as I just described. Mm-hmm. And that is important. They're both coordination, cooperation, collaboration, and communication. Every Tuesday at 4 p.m. East African time, we all come together as experts, public health experts on the continent, to discuss the pandemic and chart a way forward and adjust our strategy. So I think if you ask me what are the two main things that I've learned over this pandemic is, one, high-level political leadership, and second, effective coordination across the continent.
Thank you very much, John. Those are very fascinating indeed. What we hear you say basically that at a time when the world is fractured, I mean, there are all kinds of challenges to globalization. It is heartening to hear that on the African continent, political leadership is acting in concert, in collaboration, which is fantastic. And we also hear of the 3 C's you mentioned, cooperation, coordination, and communication, which are some of the things coming out of the continent in the year we just experienced. So let's turn now to the fact that COVID-19 did cause extraordinary economic and health damage the world over. As Cole mentioned in his introductory remarks, the naysayers up and down the world expected the African continent to be completely devastated by this virus for the reasons of public health inadequacies and infrastructural deficiencies, etc. That didn't happen. Could you tell our listeners how and why Africa weathered the storm better than people suspected?
Thank you, Aloysius. As I said, when we met on the 22nd of February, and ministers left, there was clarity of action and unity of purpose of what to do and to take the risk. And the risk was the severe lockdowns that were implemented very early on. I'll give you an example. In South Africa, before the lockdown, their numbers were doubling every 2 days. Okay, so in other words, South Africa would have been at that time at the same level where the UK was if those severe measures were not applied. Right. And we saw that across the board. Countries like Zambia, Zimbabwe impose state of emergency with 2 cases or no case. Okay, Zimbabwe went into a state of emergency without a case. So I think those were severe measures that had serious consequences on the economy, but it helped to blunt the spread of the virus. I think that is one. Second was that there was absolutely no opposing forces between the politics and public health. Okay, public health was allowed to guide the response. I, as the head of Africa CDC, have had the good fortune of briefing the head of states of the continent 13 times. Okay, 13 times, where they all gather as the Bureau of the Head of States, led by President Cyril Ramaphosa, to discuss the pandemic, find common strategies, and adjust them going forward. And in none of those 13 briefings was there any opposing views. I mean, they listened to public health advice, they saw the data, we reviewed it together, and we agreed on a common path going forward. For example, establishment of the common platform across the continent to procure diagnostics and commodities. Okay. Well, at that time, when we waited for more than 2 months and the continent finally recognized that the WHO discussions in Geneva were going to give us 2.3 million tests for a continent of 1.2 million, we went into action. We established, in partnership with the private sector, the African Medical Supply Platform, .Africa. You can Google and see that. And through that platform, we're able to obtain diagnostics. Why? Because President Ramaphosa, we went to him as the chair of the African Union and say, look, you must pick up your phone and call President Xi of China and say, look, we need you to not donate diagnostics, but give us a quarter of the diagnostics so that we can put it in the platform for our member states to acquire. So that was tremendous effort, and other commodities, right? Then we move forward to establishing the COVID Response Fund, where member states said we need to act in solidarity. Let's have a common pot, throw in money there to support Africa CDC to respond to this the pandemic, which was in the spirit of the whole of Africa approach. Then we launched the partnership to accelerate COVID testing, which were at that time in May, only 300,000 tests had been conducted on the continent. But with the PAC initiative, the partnership to accelerate COVID testing, we scaled that up very quickly. We set ourselves a target of 20 million, okay, within 2 or 3 months, and we achieved and exceeded that target because of the different partnerships that came together. So all of these efforts were very important in making sure that the continent engaged in a spirited fight against COVID-19, which is a tough fight, I must say, given where our health systems were.
Very good. So clarity of action, adherence to the lockdown by at the national level, science-based public health messaging guided the continent, and at a time when common cause and solidarity is what we hear you say. Thank you for those remarks. John, when you and I met in Addis Ababa, I believe it was in Ethiopia in 2017, I vividly recall your vision of a new public health order for the African continent. You can't imagine how that resonated with me at that time. You also
a new public health order for the continent. When you and I spoke about when we met, and I spoke about a new public health order. I said there were 4 things that Africa must do, and do it urgently. I remember where in 2017 there was no COVID. And I said, 1, we have to strengthen our public health agencies. That is, Africa CDC has to be seen in the lens of not just a health agency, but that diseases are an economic threat, a health threat, and a security threat. And I even pushed that forward. And I said, it has to be seen like a national security threat, which is a difference between just a health security threat and a national security threat. Second, we argued at that time that without local manufacturing of diagnostics, vaccines, and treatment, the continent was extremely vulnerable. Thirdly, we said that human resources, capital for response to the pandemic was very, very important, because we need about 6,000 epidemiologists on the continent. We only have about 1,900. Now, domestic financing of our own security apparatus. If you step back now and you look at that discussion, I mean, it's almost prophetic. First of all, we are all in this dialogue, common dialogue of equitable access to vaccines. And that conversation, I must say, has really created tension, what I call the North-South tension. Okay, and all because the Africa doesn't produce vaccines. Okay, and I wish that at that time we had accelerated. You don't become a vaccine manufacturer in 4 years or so. But at least that discussion that we're having now would have not occurred. Okay, if we only produce our own vaccines and diagnostics that I just mentioned. It is unacceptable that a continent of 1.2 billion, aspiring to be 2.4 billion in 30 years, will not produce its own vaccines for its own health security or diagnostics. I think that is completely unacceptable. Second is the financing. We have to be able to begin to finance our own health threats, first of all, before we look outside of the continent. Without that, we'll continue to be very, very vulnerable. And of course, what I said, strengthening our own. Look at what Nigeria's CDC has done. Okay, Nigeria's CDC is almost as old as the Africa CDC. Look at the central role that the Africa CDC is playing in this by providing good counsel to our head of states and guiding them. Before the summit, the head of states all came together twice and they said, Africa CDC, tell us if we should meet and have a summit face-to-face. And that was in December. I presented the evidence and data, they look at it, and there were 12 of them in the bureau that split half, 50-50. Half of them said, we want to have it face-to-face. Half of them said, let's wait and see how the pandemic played out. Yeah. On the 20th of January, they met again and they said, look, tell us again where we are with this pandemic, because I told them that the holiday season was coming and there's likely to be an explosion of. So they listened. They came back again on the 20th of January. They said, show us the data again. We played the data. They took a decision. It was 11-1. I mean, 11 head of states said, we've seen this data. We cannot meet face to face unless have a meeting audiovisual. That is the importance of strengthening your own national public health agency for a continental narrative. I think it completely changes the dynamics and the narrative in terms of the trust capital that the leadership has for its own health security. I mean, imagine if those head of states have come to Addis Ababa and then some of them get infected, and where it becomes a national security threat for the continent. So that is why I think that diseases are not just a health security threat, but a national security threat if the poor advice provided to the leadership.
Yeah, excellent, John. Let's stick with the financing, which you mentioned. We all recall back in 2001, right? African heads of states met in Abuja and signed the Abuja Declaration to spend 15% of their annual budget on health. Right? How has that worked out, and where do we stand now on that commitment?
I think I must say progress has been made, and I'll speak to that, but there's a lot to be done. And in 2017, when I just came here, or 17 or 18, President Kagame chaired a meeting of what they called the Africa Leadership for Health Financing. I think that it went very well. I mean, Bill Gates was there, the UN Secretary General, Chairperson Faki, several head of states. And I think that is going on, which is a good thing. I think to achieve that goal of 15%, it starts with an awareness, a strong awareness. It continues with a strong commitment, and you move from a political will to a political commitment. Right. What COVID-19 has done to the continent is clear. That, I mean, at that time, in 2001, there were expression of interest and wish, but now they see that it's a reality. That, I mean, that we must do this commitment, whether we actually get to 15% or not, but that movement has to start, and has to start now, because we cannot mortgage the health security of our continent outside of the continent. And we cannot allow external politics, the elections that happen in political capitals of Western countries, begin to determine our health security. In other words, if elections in country X pan out differently, then we begin to scramble as to whether they will support us to prevent diseases, control them. So that it was an important declaration that they did in Abuja. And I think one of our goal is to continue to work with the leadership of the African Union, the head of states, to make sure that that commitment is fulfilled. So there's a scorecard that the African Union has established, and has actually that rates countries, and I don't know exactly which countries have met that commitment or not, but I must say that there's a lot of work to be done to get to the 15%.
Sure, indeed, especially as if there is one thing COVID has done, is that every country has spent far more than 15% of their budget on this. So anyway, we watch this space and see how the tracking goes now that COVID has revealed some of these weaknesses. On the same issue of financing, John, some experts I've read recently have argued that increasing pro-health taxes, right? Taxes on tobacco, taxes on alcohol, the so-called sin taxes, right? That these sort of taxes could raise bucket loads of money for financing the health sector across Africa. What's your view on that?
I think, let me approach it from this perspective, that we need innovative mechanisms for financing health, and that those taxing those items that you listed could just be one, and using other approaches, including the very direct contribution of African citizens towards their own institutions, like Africa CDC, should be envisaged. When I meet with the youths, the AU youth envoys, and I say to her, she said, "What can we do, Dr. John?" I said, "Look, you command this continent." Okay, I say that, I mean, the median age of our continent is 20 years old. So you command the continent. So what if you go back to the youths and you say, well, I want to reach out, set up technology, use the apps that we have, set up technology, and you reach out to 200 million youths in 3 years, and let them give you only $1. Okay, just $1. You'll be able to raise 300 million, and we'll be able to fund, at least use that in responding to disease outbreaks that will protect your future. Okay, right. Because the future belongs to the youths of the continent. Africa is the youngest continent on earth. So, I mean, so that is just one avenue. So if you look at what you just described, you look at you bring in accountability, but also ownership of these programs by our youths and the continent and others. I think we have to think creatively. We cannot leave this in the hands of government alone. I think clearly it will not happen. What about partnerships with airlines? Okay, say that if you, Aloysius, fly Kenya Airlines and you are ready to give 25 cents into, allow 25 cents be charged into your ticket, like what the Europeans did with United, will be generating a lot of money. I mean, people do travel in Africa. If I can buy a ticket for $200, I can allow 25 cents to be added to it. That will go to the health security. But we really need to frame it right and show accountability and show impact, that if I do that, okay, if I allow you to charge me 25 cents on a ticket, my economy class ticket, that I will actually see the benefits going forward there. I think there are several innovative things that we should do in the spirit of a new public health order to finance these the items that I listed.
No, this is very, very good to hear, because clearly innovative financing is the way to go. In fact, the airline ticket you mentioned, one can also think of hotel nights, right? For people who spend nights in African hotels, the idea of an incremental 25 cents, by the time you calculate what's going on from across the continent, we can actually raise funds. So let's,
as you said, people, those who travel, if I can just comment on that, when I look at my change box at home from traveling, there's a lot of currencies that in the end, your foreign currencies that you don't know what to do with it. They're coins, and you just have to clean. When you are cleaning stuff, you toss it away. So give it to us. Give that to us.
That's great. I like that innovation. John, let's now turn to vaccines. Because the newspapers, the TV replete with the issue of vaccine. First of all, the COVAX facility was supposed to be a global effort, primarily for low-income and middle-income countries in Africa and elsewhere. Instead, we read about vaccine hoarding by rich countries at the expense of the poor. What's going on here? And what's being done about it from where you sit?
So from where I sit, this is my read on the situation. First of all, COVAX is an innovation that speaks to that amplifies and signifies global solidarity and global cooperation. I think is the response to protectionism or nationalism. I think that is a very much welcome initiative, which I call on all our friends of Africa, our traditional partners to continue to support it there. So we also have to transmit public statements that are nice public statements into action. I think when this pandemic started, there was a lot of all the right things were said. Timely access to vaccines,
Right.
equitable access, and whatever. But we are, unfortunately, that definition somehow got lost in translation. Equitable access to vaccines and equity became an issue of, well, if what I mean is that I'll get my vaccines first, I keep it, then we can now go to the table and discuss how you get your own vaccines there. I think that definition has changed, and we have to recalibrate that. I said in December that if we do not recalibrate that, then we are moving towards a moral catastrophe. I think, and I meant it at that time in December, that, I mean, we cannot. And we have seen this played out in Africa. I was in HIV/AIDS, a young HIV/AIDS public health expert in 1996 when AIDS drugs were available. We saw death rates decreasing drastically in the West, but in Africa it would take us 10 years between 1996 and 2006 before we saw our deaths decreasing. And between 1996 and 2006, 12 million Africans died, and I'll add needlessly. As a public health expert, when I look at that with horror. And if we didn't learn moral lessons from that, then I think that we are preparing ourselves for a similar moral catastrophe, which the next generation will ask the questions. Let it be no doubt, Aloysius, history of this pandemic will be written. And there will be three parties to the history of this pandemic. One will be those who make the history. And you have a choice of being on the right side of history and making it in the right way or the wrong way. And those who will read the history will be the next generation. And of course, those who are actually writing the history. And my hope and belief is that those who write the history will write the history taking into account what we are observing now. The same scenario we are going through now happened in 2009 during the H1N1 pandemic. And the vaccines were on mortgage. And they only became available to the developing world when the pandemic was over in the developed world. I think we really have to be courageous, sit around the table and say that what do we and say what we mean and mean what we say. And otherwise, we continue to be in this vicious cycle of creating a moral catastrophe for our world.
Yeah. No, very, very, very remarkable. The idea of, I hadn't thought of it that way in terms of looking back, those who make the history, those who read the history, and of course, those who actually write the history. This is a very interesting take on the matter. Still on vaccine, John, according to, I read recently in our world in data, right? Of the COVID-19 vaccine doses already administered as of last month, 31st of January. 31% went to the US, 13% went to the EU. And here's the interesting thing, less than 0.2% went to Africa. What does that tell you about the state of global collaboration?
It tells you that we have a lot of work to be done in the state of global collaboration. I think let me share my thoughts in this way. One, global collaboration is strong. I think we have to admit that we as the world have seen collaboration in identifying a new virus, analyzing the sequences, sharing the sequences, and within 1 year developing a vaccine. That is unprecedented.
Right.
However, what we are seeing are those weaknesses of global collaboration, how fragile it is. Global collaboration becomes very fragile when we are faced at the same time, simultaneously, with a common enemy. Okay, if this pandemic was localized, say in Africa or Latin America, we would have seen global collaboration in full display. But what we are seeing here speaks to the sociology and anthropology of a common threat. You have a common enemy and people fall inward into a survival mode there. I think we should remember that. And I must be honest with saying that it is the responsibility of the leadership of every country to, first of all, protect their citizens. That is one. Having said that, we also recognize that you cannot be naive to just fall inward. You have to recognize that a threat anywhere in the world with a disease that spread as fast as this will be a threat everywhere, no matter how much you fall inward and protect yourself with vaccinating your people. We are now seeing how this virus is evolving and mutating. So assuming that you all vaccinate in the United States and some new mutants arrive from an area of the world that have not been vaccinated, I mean, all your vaccination efforts are doomed, right? Yeah. So I think that way we should put that in the right perspective, that we are not safe until we are all safe anywhere in the world. Yeah. So I think Africa is doing its best. I mean, we have, through the initiative of President Ramaphosa, the African Vaccine Acquisition Task Force, we have secured over 300 million doses of vaccines. We are working very hard to distribute those vaccines across the continent. COVAX is promising us that they will deliver about 27% of those vaccines to Africa. We have set our target to vaccinating 60% of our continent in order to achieve herd immunity. Yeah. We are very busy now looking at vaccination processes. How do we set up vaccination centers, building the right partnerships that can allow us and go to war with what we have. I mean, you go to war with what you have, not what you need. And we will go to war with what we have. What we have is our health systems. What we have is our people. But we count on the resilience of our people, of Africans, who have fought these viruses over and over and over, the HIV, the malarias, the Ebolas, that we will be able to deliver these vaccines in a timely fashion. We believe that if the vaccines are available, we should be able to vaccinate about 35% of our population before December. That is where we begin to break the backbone of the pandemic and avoid headlines like news in journals like the Lancet, New England, that subsequently will say COVID in Africa moving from a pandemic to an endemic disease. We don't want to see that headline in the Lancet or New England journal.
Yeah, right. Let's turn now, John, to the role of technology, the role of technology in healthcare systems. If there's one thing we've all learned, is that COVID-19 has turbocharged technological innovations globally. The way we work, the way we shop, the way we travel, the way we socialize. Can you share with us any emerging technological innovations in the healthcare sector in Africa today?
I think there are several of them that are emerging. I mean, in Africa, I think the first, at least, to apply it in our response is that the ability to increase genomic sequencing and sharing that information within Africa. If you recall, and you are very good at memorizing that conversation in 2017, we talked about the Regional Integrated Surveillance and Laboratory Network, RISNET. So you'll be pleased to know that on top of that, we have now, in the middle of this pandemic, launched a pathogen genomic initiative. Okay, we built on a pathogen genomic institute that we created before COVID, which was underpinned by the ability to network more effectively and use technology to drive that. And now whole genomic sequencing has emerged as part of that innovation. So innovation here should not just be the ability to create technology, but it should be also be an ability to use technology in a more productive and impactful way. We are now in the process of setting ourselves a target of sequencing about 50,000 new genomes at Africa CDC in the next couple of months, so that we understand the lay of the land with respect to the emerging variants for this. I mean, that is in itself very, very innovative. Innovation also has to speak to in terms of the ability to create systems and institutions. I think that is very important, not just technology, because if we do not do that, innovate in our systems and institutions, then both technological innovation goes into the value of death, where you have these tools, but they can't do you any good in terms of impact and outcomes of diseases, I think, in Africa. I think that is one. The second thing that you see across the continent now is local manufacturing of diagnostics. I can now name you 5 countries that, or 6 countries that are begin to produce COVID-related diagnostics, which were not there, before. Let me share these statistics, unfortunate statistics with you. Each year, the continent conducts about 100 million HIV tests, but there's no single country in Africa that produces a simple rapid test for HIV, and we have been doing that for 40 years. However, COVID brought the hard reality to us, and now Senegal, Nigeria, South Africa, Kenya, Morocco, and Ethiopia are now producing or beginning to produce diagnostics for against COVID-19. That is huge. I mean, it will be transformational. Now I can call Amadou Sall in Senegal and say, hey, Amadou, I need antigen tests for COVID-19, and they'll ship me antigen tests and repair. So I think we are making progress thanks to the unfortunately driven by this sad pandemic.
Right. So it goes to the old adage that necessity is the mother of invention. So it's great to hear that a number of innovations on the technological fronts. John, let's now turn in the time we have to other challenges, right? So the notion of antibiotics, antibiotic resistance has been, this is called, as you know, in fact, you once described it that way to me, the silent killer. Okay, some estimates show that many more African lives are lost through antibiotic resistance compared to other diseases. What's the Africa CDC's agenda for tackling this silent killer?
Thank you, Aloysius. First of all, when I said earlier that I dread to see a headline in the Nature, Science, New England, or the Lancet that says COVID-19 in Africa from pandemic to endemicity. That would be a catastrophic headline. The day you see that, I mean, you can throw your hands up and we go home. Because Africa is faced with endemics. Okay, we have the rising, the tidal wave. The new tidal wave in Africa is the rising non-communicable diseases, which are also serious silent killers. And compounding that is also the issues of antimicrobial resistance. From the O'Neill report, we know that if nothing is done with antimicrobial resistance in Africa, from here to the next couple of years, about next 30 years, about 4 million Africans might be dying every year because of the complications from antimicrobial resistance. Remember, we still have a second pandemic, which has been swept underneath the carpet now, which is the HIV pandemic. HIV kills more than 500,000 Africans a year. Combine that to tuberculosis, which kills a similar number, and malaria, it gives you about 1.2 million deaths a year in Africa because of non-COVID related. My fear is that COVID is going to aggravate those conditions because we are not paying appropriate attention to those. People are not using hospitals, so you get more COVID-related deaths than COVID infections, which today we are approaching 100,000 deaths from COVID infections over the last 1 year. So back to the issue of antimicrobial resistance. We at Africa CDC are taking a more holistic approach. We have now developed a framework of one herd to approach antimicrobial resistance, harnessing all the assets that exist within the African Union. That is the agriculture, animal, health, and human health, and say, let's work together. So a framework exists on how to work together. A common position for antimicrobial resistance at the policy level has been adopted, produced by Africa CDC and adopted at the continental level. So we have that. And of course, a series of capacity development are going on together with partners to address that gap. But it will take all of us and the whole of a society approach to begin to address the issue of antimicrobial resistance, which speaks to accountability and also speaks to our own behavior towards antimicrobial use of antibiotics there.
That's great. Before we turn to the audience questions, let me just on one last issue, which is, I believe, of tremendous consequence. This is the issue you and I have talked about on numerous occasions, the issue of autonomy for the Africa CDC. The ability of any CDC anywhere in the world to operate with autonomy is important. Why? For institutional effectiveness. It's important for organizational efficiency. This here in the United States, we saw how the erosion of the autonomy of the Atlanta-based CDC, where you worked for many, many, many decades, right? In the past 4 years has compromised the integrity of the CDC's response to this global pandemic. What's the situation now regarding the autonomy of Africa CDC?
So thank you, Aloysius. That is a very good question. I just wrote a worldview piece that will be published in Nature Medicine in the coming weeks. And one of the centrality of that is speaking to the autonomy of the need to have a new global health security architecture. That speaks to the global level, the WHO being strengthened and empowered. And that also says that where WHO was created in 1947 and the world's population was like 2.5 billion people, and now we are about close to 8 billion. And also speaks to the need to have regional structures like Africa CDC that will also be strengthened and empowered, because having a public health agency that is not empowered doesn't lead anywhere. So I think that is clear. So that segues to the concept of its own autonomy. Africa CDC is 4 years old. I mean, we celebrated our 4th anniversary just on the 31st of January, and we continue to make progress there. One of the highlights of the recent summit, that is the Head of State Summit that just occurred over the weekend, was that head of state by head of state were all cleared with the call for Africa CDC's autonomy to be accelerated. President Ramaphosa took the podium and was very sharp on that. President Kagame spoke on that. The closing remarks of the meeting, and there's an audio and video that is circulating from President Tshisekedi, who is the current chair, outlined the major things that the continent will focus on. Number one was the need to get Africa CDC's autonomy and empower its leadership there. It came straight from the lips of President Tshisekedi. So there is that strong political commitment and will now, and I believe that Chairperson Moussa Faki has spoke in his speech very clearly the need for Africa CDC to be strengthened and empowered immediately. So I think there's a lot of momentum in the right direction there. I'm very encouraged by the leadership that Chairperson Faki is exercising in that space. Very encouraged by the commitment that our head of states are now taking, realizing the valuable role that dear CDC, which are usually characterized as the greatest political innovation out of their great wisdom and vision, has played during this pandemic.
Oh, that's fantastic. I think our audience is very delighted to hear that. Where there is a will, there is a way, right? So this is all very reassuring. Let me turn now to some of the questions we got from our audience in the time we have available. There's a question here from Rumbi Musakaruka from the AFDB, Fragility Assistant, asks, will the Africa CDC support development of homegrown African vaccines for COVID and other diseases? Is this work already underway? I think you touched upon that a little bit earlier on.
Yeah, sure. I think a succinct answer that would be just yes. Okay. And I stopped the period because that's what we should be doing.
No, that's great. That's thanks, John. There is also a question from Scott Collins, Austin Innovation Group CEO. The question is, I've seen innovation go a long way in making what is considered impossible become reality. Based on what you see as the likely response to the next pandemic, or even the ongoing mutations to COVID-19, what are the weak links in the planned response that innovators of technology and businesses can work to solve?
I think that that's a very good question. I think we have to, first of all, as I said earlier, step back and recognize the great innovation that went into understanding this virus within 1 year and doing the kind of things that have been done. We are now, we see the light at the end of the tunnel because of the COVID vaccines. Right. But I always caution that we should recognize that our only failure in this fight against COVID-19 will be the failure for us to admit some of our own failures. I think that is very, very clear that there will be failures. And as we fight this virus, I'm a virologist for 32 years. I work in HIV for 29 years. Failures will come in, but each time we fail, we'll grow in that. And the only way that we address our failures, if we admit them in timely, will be to innovate. Okay, absolutely. We have to innovate. A good example is the variant. For one thing, if I compare the struggle to get a vaccine against COVID-19 and a vaccine against HIV, I go to bed at peace. I know that this virus, no matter how much it mutates, we can beat the virus if we innovate ourselves. We now know how to develop a vaccine against it. We know the weaknesses of the envelope of this virus, the spike protein. Even if it changes, we can also change and adapt it and whatever. It may just require that we use maybe a trivalent vaccine that targets many pieces there. So I think that innovation is key in our fight against this environment. I want you to think of a formidable, let me caricature a virus that you go to bed being terribly afraid of. A virus that changes and hides its own antigens like HIV, covers it so that you can't even design it, that spreads very quickly, okay, like the SARS, it spreads very quickly like the COVID-19, but also has a fatality like the SARS, okay, SARS virus, then you are cooked, okay, you don't, so we just have to make sure that our innovation, the apparatus keeps growing and we keep sharing.
Right, no, this is excellent. John, if you and I had to have this conversation fast forward to January 1st, 2030, what do you believe in retrospect would be different in Africa regarding disease prevention and control?
So let me, Aloysius, paint a future of 2030 in Africa. And I would like to sit in 2030 and see Africa with a strong network of public health institutions, all working together seamlessly. I would like to sit in 2020 and point to at least 3 or 4 vaccine manufacturers in Africa that are backed up by research hubs, okay? Because you don't just develop vaccines overnight. You have to be in constant R&D. So you have research hubs across the continent that feed into that vaccine development and diagnostic space. I would also like to see along that same line several clinical trial sites that are ready all the time to take products from vaccine manufacturing and put it into clinical trials and get the results. In 2030, I would like to say that see a proportion or the percentage of our member states contributing to their own health security increase in a very deliberate fashion, to the extent that they say that in public that, we are investing X dollars because we recognize that $1 investment into our health returns $4 or $5, and that is a fact, that a reality there. And lastly, I would like to see a very competent public health workforce for the continent. In this pandemic, Aloysius, very briefly, I would like to describe this scenario as we draw to an end, where in May, I had to go to the Peace and Security Council and make a case that they should work with the member state to lend us a military plane. Because at that time, no planes were flying across the continent, but member states were requesting us to support them in Mali, Burkina Faso, Niger, and Cameroon. Took that military plane to DRC, took 28 responders that we were using in North Kivu, loaded them in that military plane and dropped them seven epidemiologists, dropped 7 in Cameroon, 7 in Burkina Faso, 7 in Niger. We were flying overnight across the continent that no airline was flying, our military planes were flying, and we want to see that scenario change in 2020, where each country has frontline responders and we have to train them as if we are at war. We are at war with this pandemic, with these viruses there. No war in Africa has created almost 100,000 deaths in 1 year. Okay, none. And here we are with a COVID pandemic that has killed close to 100,000 people in Africa. My greatest fear is that we begin to normalize these deaths and say, well, after all, there are about 2 million deaths across the world and only 100 million in Africa. They are loved ones. They are brothers, they are sisters, our uncles, our aunts, our mothers. And I think we have to put that in context in 2030 when we develop an army of responders that will stand up and fight these pandemics if they occur, and they will occur.
Right. John, clearly we could go on and on. No wonder you're one of Africa's favorite sons. With a couple of things to take away. The Africa CDC has really, under your leadership, come of age, responding very, very well to what is clearly the world's most consequential pandemic in our lifetimes. The continent is not out of the woods yet, is what we're hearing. Indeed, the second wave is raging now as we speak, where the commitment, the strength of ownership, and the solidarity of the African leadership is really important. On vaccinations, I hear you say the world is not safe until Africa is safe. So John, thank you very, very much for choosing to spend your time with us today. Please come back and share with us as the situation evolves. I would like to also use this opportunity to thank all my colleagues at Brookings and AGI who made this event possible today. And of course, to our Vice President, Brahima Coulibaly, who gave the opening remarks earlier. John, I thank you very much. And to our audience all over the world, thank you very, very much. Thanks, John. Okay.